My name is Celeste Spear. I am the Associate Director for the Business Career Center at the University of Nebraska-Lincoln. Before that, I was a psychology major and I was the academic advisor for the psychology department for 6 years. So hopefully I have a little something to share with you today about master's degrees and going to graduate school outside of psychology. So our agenda today, we're going to be talking about several degrees, specifically master's degrees, counseling, social work, marriage and family therapy, school counseling, and industrial organizational psychology, as well as a few areas outside of psychology that are great for psychology majors. So specifically about master's degrees in the field of psychology, we're going to be covering the ones that lead to becoming a therapist, as well as some others outside of therapy, but still great options. The ones that lead to becoming a therapist are a master's in counseling, a master's in social work, and a master's in marriage and family therapy. Within a master's of counseling, you're going to see a few different titles. You could see mental health counseling, you could see counseling psychology, or you could see community counseling. I've even seen others like a master's in professional counseling or a master's in clinical counseling. So there's a wide variety of terms for the master's of counseling. We'll talk about specific terminology to look for later when we dive into that degree. A master's in social work, and then a master's in marriage and family therapy. Those titles don't differ as much. So the first one, the master's of counseling. Again, you're going to see lots of different names for it. It leads to being a master's level licensed therapist. In Nebraska, that's called a licensed mental health practitioner, or an LMHP. You will see clients that include individuals, couples, families, and groups that present with a wide variety of different adjustment and mental health issues. You can practice independently with your master's in counseling in most states, including Nebraska. You have to apply for an additional license after working for 3 years under someone with a PhD, but you can open your own private practice in most states. If you're looking for programs outside of Nebraska, you may see other program titles like I alluded to before, but the language you want to look for is that it meets the requirements for licensure in that state. So licensing at the PhD level, for example, with a PhD in clinical psychology is going to be licensed at the national level by the APA. Licensing at the master's level happens by state, so that's why you see different program titles, different licensing requirements. So if you are going to go to school out of state, just make sure that you look for that language. It may be housed outside of departments of psychology. It could be in educational psychology or family science. Here at the University of Nebraska-Lincoln, our Master's of Counseling Psychology program is housed in the Department of Educational Psychology, not the Department of Psychology. So as you're looking for programs, just know that you might find them elsewhere. A Master's of Social Work leads to becoming a licensed Master of Social Work, or an MSW. They can work with individuals, couples, families, and groups, and they work with clients that present with a wide variety of adjustment and mental health issues. You're going to see a pattern here as we talk about these different degrees. Keep in mind that some social work programs require you to have a bachelor's degree in social work or take a year of prerequisites if you don't have a bachelor's degree in social work. So just know as you're applying to programs to look for that. Other programs accept non-social work majors right into the program. Social workers can practice independently in all 50 states. I'm going to add a little side note here to ignore the negative and inaccurate stereotypes of social workers, especially when you're getting to that master's degree in social work and becoming a licensed social worker. You're doing the same type of master's level therapy that these other degrees are doing. And there's absolutely fantastic career options in this field. It's a highly sought after degree, especially in education and medical settings. And the final degree that leads to becoming a licensed therapist is a Master's of Marriage and Family Therapy. So a Master's in Marriage and Family Therapy leads to becoming an LMFT. They work with individuals, couples, families, and groups. So let's stop here. One one inaccurate assumption by psychology majors is that they often think that if they want to work with couples or families that they have to have a degree in marriage and family therapy. That is not the case. No matter how you're licensed, you're going to work with individuals, couples, families, and groups. The reason why this degree is called a master's in marriage and family therapy is not the type of client you work with in the end, but more so how you're trained in the type of therapy that you do. So marriage and family therapy programs train you in what they call family systems approach, which is simply an approach to therapy that uses close interpersonal relationships to understand current presenting issues versus, for example, cognitive behavioral therapy, which is more common in counseling psychology, which really focuses on your individual thoughts and feelings and working through those. So again, it's not about the type of client you see in the end. It's about your training while you're in school and the type of viewpoint that you take on your therapy, not the client that you see later on. Clients will present with a wide variety of adjustment and mental health issues, and LMFTs can practice independently in all 50 states. We are seeing some title changes in these programs. Couples and family therapy is a more inclusive title that is gaining traction. And it's usually offered through family science departments, not psychology departments. So you may have trouble finding this one if you're just looking in psychology departments. So here at the University of Nebraska-Lincoln, our family science department is called Child, Youth, and Family Studies, and that is where our marriage and family therapy program is housed. So the process of becoming a master's level therapist, how does that work? First, you're going to complete your master's degree, which is generally 2 years of coursework. Then you're going to do an internship. Most of these master's programs have a pretty significant required internship, anywhere from 6 months to a year, depending on the program. At that point, you'll graduate with your master's degree. You'll go to the state that you're living or planning to work, and you'll apply for what's called a provisional license. You'll practice for 1 year under the supervision of a fully licensed therapist, often at the PhD level. And then you'll apply for your full licensure. Now, if you got the LMFT or the MSW, that's the end of the process. You're fully licensed and you can practice independently at that point. If you are doing the Masters of Counseling, or if you did the Masters of Counseling and want to practice independently or open your own private practice, you would practice for 3 years under a PhD level psychologist and then apply for an independent license, again, if you wanted to practice independently. So I often got the question, which degree is best? And the answer is, it depends. It really depends on your unique interests and career goals. The differences between the programs are pretty slight. The type of work you do in the end is very similar. Again, working with individuals, couples, families, groups, and a wide variety of adjustment and mental health issues. So the differences are more about the type of coursework that you take in the program, the way you learn how to do therapy, and the slightly different lens that each one uses. So counseling tends to be based in psychology. Social work takes a little bit of a broader approach, brings in sociology, kind of social justice perspectives. So you'll learn a little bit more about how things like sexism, racism, and poverty are affecting your clients. Marriage and family therapy, again, uses that family systems approach to learning how to be a therapist. So they take slightly different angles, but they end up working with the same types of clients in the end. So how do you figure out which one is best for you? One, you can go to these program websites and read about the coursework that you would be taking and read about the faculty that teach those classes. You can pretend you're doing a job search right now. One of my favorite sites for job searches is Indeed.com. Start searching for mental health counselors or social workers or marriage and family therapists and read through the job descriptions or see which types of degrees are being asked for by the types of industries that you're interested in working for. And finally, talk to people who work in these fields. Talk with somebody who has a master's in counseling or versus a master's in social work. See what they like, what they don't like, what they would recommend, what they see as trends in the industry. That might help you know what degree is best for your goals. So some pros and cons between the master's degree and the doctoral level therapist. At the master's level, you're going to make less money. Starting salaries are in the 30s to 50s, and this is in Nebraska. They may need to be supervised by a doctoral level therapist on an ongoing basis. Unless you open your own private practice, you might work in a practice where that's simply the structure, that you have a certain level of supervision from that PhD level person. They may not be able to perform some tasks such as assessment and diagnosis, and the level of autonomy varies by state, but it's growing and growing every year. At the doctoral level, some of the downsides are that it does take a long time to earn your degree, probably 5 to 6 years. It's the highest competition for admission. So when you're going to apply to programs, for example, clinical psychology, acceptance rates can be as less than 10%. Versus the master's degree, acceptance rates are generally in the 40 to 50%. So it's a much tougher battle to get into a PhD program. PhD programs are going to be more focused on research. They're going to have a dissertation component, which is based on independent research. You will often have to relocate, and often multiple times. For example, you may have to move to go to the program you're accepted to. There, especially for clinical or counseling PhD programs, there's a required 1-year internship at the end of those programs. You may have to relocate to do that internship because competition is fierce for those internships. And then you may have to relocate again to actually secure full-time employment. So again, competition is definitely higher at this route, and you have to be willing to travel a little and sometimes more than once. You will probably have more administrative duties if you go to the PhD level and do more assessment and diagnosis versus therapy. So if you're really more interested in assessment and diagnosis versus doing therapy, this would be the better degree for you. Again, depends on your interests and goals. Some of the good things about each degree. So the master's degree, it's a shorter time to earn your degree. You're going to be in and out in 2 or 3 years and making money sooner. Paying less for your program possibly. It's less competitive for admission. Like I said before, acceptance rates in the 40 to 50%. Less focused on research. So if you're not a big fan of the research and want to just become a practitioner, master's degree will lend itself better to that. More focus on practice and therapy. So if that's really your interest, the master's degree is really geared toward learning how to do therapy. There's actually more jobs available in the job market. Now, this is a little counterintuitive. You may assume that if you get that highest degree, that PhD in psychology, you're going to open the most doors. But the way practices are actually structured is that there's a few people on top with a doctoral degree and then several people working under them with master's degrees. So one person to kind of do the assessment and diagnosis, and then a group of master's level folks who actually deliver the therapy. So just know that there's a wide variety of jobs available at the master's level. And again, they're being allowed more and more autonomy by law every year. So although they have less autonomy than the doctoral level folks, they're gaining more and more. At the doctoral level, this allows for the most autonomy to practice independently if that's one of your goals, and it allows for the broadest set of skills and abilities, again, incorporating that assessment and diagnosis as well as the administration. It allows for the highest level of upward mobility. So if you really see yourself as being, for example, the director of clinical services at a hospital or a professor or a dean or something like that, you want to shoot for that PhD. It also has the highest pay, again, starting in the 60 to 80 range in Nebraska. So another question I often get from students is, so what can I do with a PhD that I can't do with a master's degree? I've alluded to this before. Assessment, testing, diagnosis is often reserved for that doctoral level person. Administration, so these would be things like dealing with hiring, strategic planning for the office, supervision of other people, dealing with billing, insurance, business type functions for the office. Those would be on the shoulders of that doctoral level person. And then being a faculty member or professor is generally reserved for those with a PhD. So a few considerations for the master's versus that doctoral level degree. Try to avoid viewing one as better than the other. there's pros and cons to both, and you need to pick based on your unique interests, skills, values, and career goals. So I like to compare it to being a doctor versus a nurse, or a teacher versus a principal. We don't view one as better than the other. People have a different set of skills and personality and goals and career goals that are going to lend themselves more than likely to one or the other. So I want you to try to pick based on that, not as assuming that PhD is going to be better than the master's degree. So moving on to a couple different degrees. So we have the school counseling and school psychology degrees. So school counseling is a master's in school counseling leads to be a school counselor or guidance counselor, sometimes called. They provide educational and vocational guidance to students and help resolve academic, behavioral, or personal issues that may be blocking success. So these a school counselor is going to work with the general school population to make sure that all students are doing well academically, progressing, and able to achieve whatever goals they have after graduation. In many states, you must have a teaching certificate and teach for 2 or more years before you can become a school counselor. That used to be the case in Nebraska. They have recently created a non-teacher pathway to becoming a school counselor. So you still need that master's in school counseling, but instead of that teaching certificate and 2 years of teaching, you can now do 12 additional online credits of training to become a school counselor without being a teacher first. So again, if you're in Nebraska, you need the master's of school counseling and the 12 additional credits. But if you're going to another state, be sure to research what those requirements are in another state. If you're going to a state that requires you to be a teacher first, it's probably a more expedited plan to have a major in education, not psychology. Major in education, get your teaching certificate, teach, and then get your master's in school counseling. That would be the quickest route for those states that do require that teaching certificate. There's another degree in school counseling, or school psychology, that's a little more advanced than a master's degree, but not quite a PhD. So if you're thinking about school psychology, you'd be looking at an educational specialist degree. It's generally about 3 or 4 years, and it leads to becoming a licensed school psychologist. So what's the difference between a school counselor and a school psychologist? So a school counselor, like I said before, is going to work with the general student population, students who don't necessarily have, any additional learning issues or problems at home, but the general student population. The school psychologist then is going to work with a smaller set of cases, students who have learning disabilities, other mental health issues, problems at home, other adjustment issues where they really need an intervention in order to get back on track. So they're going to do assessment and create a learning plan. They're going to work in conjunction with teachers, administrators, parents, and the student to put a plan in place to help that student be successful. And so again, smaller caseload, more severe cases. And again, that degree is an educational specialist degree, which is a little bit more than a master's. And finally, industrial organizational psychology. Now, this is an area of psychology that you can do with a master's, very different than the ones we talked about before in terms of it's not therapy or counseling. This is a degree in the world of business. So you're taking psychology concepts and you're applying them to the world of work, to the business world, to help companies run better based on understanding how people work and how people work their best. And it's a very in-demand area of psychology with high pay, especially for the master's degree. So if you have an interest in really applying concepts to the real world, this is a great degree. I would consider a minor in business if you're thinking about this degree. And some masters in IO psychology do require some business courses as prerequisites, so be sure to look into that. So There's a lot of other areas of psychology. If you want to work directly in these other areas, I would recommend a PhD. Now, that's not to say that you have to have a master's or a PhD for a career in psychology. Lots of options with a bachelor's degree, but that's a whole nother lecture. But if you want to work, for example, as a consulting psychologist or a quantitative psychologist or a social psychologist, you're going to want a PhD for those industries. I've talked a lot about counseling and counseling psychology today, so I want to clarify that with clinical psychology. So clinical psychology is going to assess, diagnose, and treat people with severe mental illness. Things like schizophrenia, bipolar disorder, depression, PTSD, eating disorders, addiction. Most jobs in clinical psychology require a PhD. If you think about mental health on a continuum with less severe on one side and more severe on the other, clinical psychology is going to focus on the more severe side. Counseling psychology assess and treat people with problems, adjustment problems is what we call them. They're related to social, emotional, educational, or work-related adjustment, such as marriage issues, the death of a loved one, problems adjusting to college, issues at work, those types of things. So it's going to be people who are, for the most part, mentally healthy and functioning, who just need help getting through a particular time in their life. Again, look at that continuum, the counseling psychology is going to focus more on the less severe side of the mental health issues. Working in counseling psychology only requires a master's degree, and individuals can pursue the PhD, especially if they're interested in teaching or research. The differences are blurry and they overlap, and they're going to differ by individual. For example, someone could be struggling with depression and see a counselor because it's something short-term associated with a life change, or it could be a mild case of depression. Or someone could have very severe depression, which really affects their life and is a chronic problem for them, which they may see a clinical psychologist for. So again, the boundary isn't absolute and it's blurry, but that's kind of a general distinction. Another question I got from students is, if I want a PhD, do I need a master's degree first? And the answer is no. If you're interested in a PhD, apply directly to PhD programs. You can do your bachelor's degree in psychology and then go right on for your PhD. And you can do a master's degree first, but it may not shorten your time to earn a PhD. I would recommend getting a master's degree first if you're an undergraduate and you're graduating soon and you're not competitive yet to get into a PhD program, or if you weren't accepted to a PhD program, you could do a master's degree first to increase your chances of being accepted into a PhD program. They can serve as a stepping stone, like I just said, to get into a PhD program. And they can serve as a backup plan for a PhD-bound student. So your number one goal might be to get into the PhD program, but if you're not, you might be okay with a master's degree too, and that's fine. Most PhD programs will allow you to earn a master's degree en route to your PhD, but it's not necessary, and they're not going to accept you into the PhD program if you're going to stop out at the master's degree. So usually a PhD program will have an option of writing a master's thesis and kind of earning a master's degree along the way, but it's really not required of you. Once you have that PhD, whether or not you have a master's is really a moot point. Another common question is, do I need to do research as an undergraduate to get into a master's program? And the answer to this one is it depends. It depends on the type of program you're applying to. So when you're researching your programs, you're going to see some different language used. You're going to see a scientist practitioner model, and you're going to see practitioner-based model. In general, for scientist practitioner models, you're going to want some research to get into that program. For practitioner-based programs, generally no. They're going to not have research as part of the program, and they might not even have a thesis required with the program. They may do a longer internship or a non-research-based paper at the end. So preparing for a master's degree, have a high GPA, at least a 3.0, a 3.5 or higher would be best. Gain experience. This is going to be the key to getting into a master's program, especially a practitioner-based one. They're going to want to see that you've done volunteer work, an internship, a part-time job, or something in human services or mental health or in the community where you're really working with the types of people that you'd be working with in a mental health setting. Generally, for research, counseling psychology would be the most likely to require research. Research is generally not required for mental health counseling, community counseling, social work, or marriage and family therapy. With that said, research is still a great resume builder, and it's a great way to secure a letter of recommendation from a faculty member. Sometimes it's hard to get to know a faculty member in a large classroom. That research setting really makes it a lot smaller. I know I did research for 3 years, and so that was a great way for me to get to know that faculty member over a much longer amount of time versus one or two semesters with classes. The GRE, you may or may not have to take the GRE. About a third of master's programs require it, so I'd recommend identifying which programs you want to apply to first. If one of them or more requires the GRE, you'll need to take it. If they don't, you won't need to take it. So don't assume that you have to take the GRE at the master's level. And 3 letters of recommendation. I'd recommend at least one faculty member, at least one person from that experience that you're gaining outside the classroom that I mentioned before, and then one other person kind of to fit your interests and goals. So it could be another faculty member, it could be someone who supervises a student organization that you're involved in, it could be another person from experience. Perhaps one is a supervisor and one is a coworker. So a lot of different options for that third one. And finally, keep in mind that you can go to graduate school outside of the field of psychology. When we get to the graduate level, there's a lot of what we would call interdisciplinary programs that psychology majors are a great match for. So these are just a few of my favorites. So the first one is student affairs. This would be working on a college campus, working with college students in a variety of different ways. It could be career services or education abroad, academic advising, residence life, Greek life. If you have an interest in, helping people be their best in a college-age population, it's a great degree. Another one of my favorites is the applied behavior therapy. So this is a newer degree, and it really specializes in working with people on the spectrum. Asperger's, autism, other learning disabilities. If you really have an interest in those types of populations, it's a great and very in-demand degree, especially in an educational setting. If you have an interest in health, for example, you're a pre-health student or pre-med or pre-health, I would look into a master's in public health. A master's in public health is more about treating a community and making sure the community is well versus treating individual people. It's often a great match for someone who's interested in psychology and health. And finally, psychiatric nursing. So a psychiatric nurse can actually assess, diagnose, and prescribe medication. So again, if you have an interest in psychology and health, that's a great way to put those two things together. But again, don't be afraid to go outside of psychology because there's a lot of programs you may not even have heard of out there. So try to think outside the box. And that's all I have for you today. Thank you for joining me, and I'd be happy to answer any questions if you have any. Take care.